Hi, I'm Nancy Brown, Chief Executive Officer of the American Heart Association. This Heart Month, I am so delighted to be joined by Representative Joyce Beatty, co-chair of the Congressional Heart Caucus, chair of the Congressional Black Caucus, a dear friend, and former member of the American Heart Association. Joyce, it's so good to be with you today.
Thank you. It's truly my honor to be here, and I'm always excited when we can impart some knowledge and some education on this topic.
Absolutely. And as you know, Joyce, very well, cardiovascular disease is the number one killer of women. It claims the lives of 1 in 3 women every single year. What makes Heart Month so important to you?
Well, Heart Month is so important to me when I reflect on it from a personal standpoint. My mother had heart conditions. My grandmother died of a heart attack, and I'm a stroke survivor. So it's very important to me that I have the opportunity to do chats like we're doing. I think it's so important to women. You just gave us the statistics that it's the number one killer for female. So it's important that we educate. It's important for me as many times as I can, Nancy, to tell women to listen to your body. And so I enjoy this, whether it's this or whether it's Go Red for Women, whether it's the Circle of Red, or it's actually watching you work magic in a boardroom. I'm all in because it's very personal to me. And I think that's the best way to convey our stories to the public. You all do that so well with the Heart Association. You bring people in who are very diverse, young people, married people, single people, professional people. And that tells the story that it can happen to any of us.
It's so true, Joyce. You know, I'm reflecting on how every year for so many years you have graciously convened the passionate and powerful women of Congress when we were able to be face to face for our annual Go Red congressional photo. And thank you so much for doing that. And I know during the course of those photos, I've had a chance to talk to some of your colleagues in Congress. And one of the things that people don't know, that in addition to cardiovascular disease being the number one killer of women, it's also the number one killer of new moms. And I recall having this discussion with one of your colleagues a couple of years ago, and it strikes me that we need to continue to raise awareness of this and to reduce health disparities in pregnant and postpartum individuals. What do you think about that? What ideas do you have, or what reflections do you have on that?
Well, it's interesting that you mentioned that. I belong to the Heart Caucus. And when we talk about maternal deaths, I think it's important because most people don't know that 1 in 3 pregnancy-related deaths occur. And for brown and Black women, it's 4 to 5 times higher than their counterparts. There's so many disparities, and I think people don't know it. You know, so often when we talk about the number one killer, there was just a survey we did with women in organizations, and many people thought it was cancer or one of the cancers. So when we started talking about the relationship between cardiovascular disease and the relationship between stroke, and then when we talk about maternal death and how that's related to cardiovascular, it only tells me that we have to get more information. And I think it's education and awareness. And so often it seems so complicated. So I go back again to having physicians come on and tell their own stories or the stories of their patients. And I think it starts, or should start, at the very beginning of your pregnancy, when you start thinking about being pregnant. And there are no questions that are off limits. People are so afraid to ask, what should I be doing for healthcare? Should I look at my family background? When you look at what might be hereditary or through genetics. So I think all of those things we have to discuss.
Yeah, such important points. And I'm really glad you brought up the issue of health disparities. And first of all, before I ask you a question on health disparities, I want to tell you how proud I am of you and how excited we are that you've been named the chairwoman of the Congressional Black Caucus. That is so exciting. And as we commemorate Black History Month, I'm very interested in your perspective on how we as a nation can address health disparities and improve health in all communities. Clearly, this has become so much in the spotlight with the COVID-19 pandemic. It's something we've known at the AHA for a long time, and we've been working to address these issues for a long time. You now have a unique vantage point and an opportunity to influence this work. We'd love your thoughts on it.
Well, let me just say thank you so much for that. It is an honor that I have been elected by my peers in Congress to be the chair of the Congressional Black Caucus. And by the way, this is our 50th anniversary, and it is our historic number of members. We have the largest caucus in the Congress. You won't be surprised by this, but as a matter of fact, not one of my number one priority is, of course, healthcare. And so when we talk about COVID-19, when we talk about cardiovascular and stroke disease and diabetes, that's all up front. Because when we mention disparities, Black Americans make up 13% of the national population. And when you look at COVID-19, for example, we're in the numbers of 18 or 20% with the death rates. When we look at cardiovascular disease, we're 30% higher than our non-Hispanic and white Americans. So we know that we are affected disproportionately. We also know that research and statistics indicate that we have to look at the correlation between Black Americans who are diabetic, obesity. We also know oftentimes when you look at poverty, we are in greater numbers because of all of those critical factors. And certainly I have to say, and the cultural and systemic racism that is there. All of that right now is why in government and in your work, we're looking at disparities. You have an amazing research arm that you pay a lot of attention to. And I think it's so important for people to know that there is not a face that can't be affected by this. So this is a bipartisan effort. We have women of all races and ethnicity, political parties. Everyone gets excited about making a difference and fighting against cardiovascular disease. And I don't think you can get any better research or factors or individuals then you can come and say, Congress is doing something right. We are fighting against cardiovascular disease.
Absolutely. And we're so grateful for all the support. When we speak about health disparities, here's a statistic for you that you'll be interested in knowing, Joyce. We, of course, have long championed high quality, affordable, accessible healthcare for all Americans. It's a value we share, you and I share personally, and it's certainly a core pillar of the work of the AHA. We released a study that was presented at a scientific meeting we had about hypertension back in September that showed that the percentage of people who have their blood pressure under control is declining. But for individuals who have not seen a healthcare provider in the last 12 months, they have an 8% control rate. So that is unacceptable. And it just speaks to the importance of access to healthcare, fighting disparities, addressing the social determinants of health, all the things that you have articulated so beautifully, all the things that are an important part of your platform as chairwoman of the Congressional Black Caucus and as a longtime friend and advocate of the American Heart Association. Congresswoman Joyce Beatty, thank you for your time today. Happy Heart Month.
Thank you.
Yeah, there you go. Perfect.